This has been very upsetting when you can't see. I can't read anymore. I can't watch TV. Can't drive, obviously. There's not a whole lot left that you can do.
Pemphigoid is one of the autoimmune diseases. It affects the conjunctival surface of the eye and the corneal surface. It causes a tremendous amount of scarring in advanced disease.
Pemphigoid is a really unique and devastating disease. It affects patients' quality of life significantly. It affects their vision, it affects their pain and their ability to keep their eyes open, and sometimes it affects their appearance.
It's a really rare disease, so to have doctors and referring physicians having either never heard of it or hearing about it for the first time or not being sure of what they're dealing with, that's very common.
We started this clinic that was multidisciplinary, coordinated care, and we would put our heads together and decide how best to approach and manage these very difficult problems that most of the general ophthalmic community are happy to move out of their office because they're so difficult and complicated to take care of.
That we have 2 oculoplastic surgeons, 2 cornea surgeons, and someone who does immunosuppression. That gives us the ability to talk with each other, make decisions on these patients right while they're there. One patient I remember who was an older lady, her family said she only sat in the house, did nothing, really was depressed, and she came and saw us, and over some time we were able to do surgery where we replaced her cornea and reconstructed her eyelids. And her family said the change was miraculous. She suddenly was with her family, saw her great-grandchildren.
But one that comes to mind quickly is a patient who had devastating and aggressive pemphigoid, and she had a corneal perforation in one eye, and that eye was emergently transplanted. And then her other eye, which started out as her better eye, unfortunately became totally blind and not salvageable. And so we went back to the original eye and were able to do a keratoprosthesis and a special tarsorrhaphy where Bob Penne closes the lids around the keratoprosthesis. And it was amazing. The patient had gone from looking like she was blind and kind of wanted to die. When she got her vision back, it really was amazing to see her engage and be back in life once her vision was restored.
It was hard for me because I'm so used to doing everything myself. And I just couldn't, because I couldn't see clear enough. But with my vision back a little bit better now, at least I can cook.
What's your favorite thing to cook?
Anything.
We get patients up and down the East Coast. We have had patients elsewhere in North America, and we've had patients from outside the country who've come to see us, from as far away as China.
It's tremendously rewarding to take a patient who's been told that there's nothing that can be done for their eyes and actually restore some of their vision. We can have an enormous impact on the patient's quality of life, and that's why we go into ophthalmology in the first place.